Good morning and welcome to the Epilepsy Foundation of Minnesota's community gathering. My name is Glenn Lloyd and I am the Executive Director at EFMN and will be your host this morning. In light of the physical distancing measures to slow the spread of COVID-19, we're excited to spend this time together sharing medical advice and tips, mental health and wellness tips, as well as updates from the EFMN staff regarding our programs and events. We will be together for the next 45 minutes and look forward to staying connected throughout the stay home orders. Now, before we get started, let me share our housekeeping tips so you can enjoy this community gathering without worry. All audio and webcams are disabled other than our speakers. To ensure your engagement remains active, we encourage you to submit questions for our speakers through the question box provided by our webinar. See the question box in your settings pop-up window. Submit your question for a specific speaker during their interview, and we will ask it with time permitting. Well, first of all, we want to say thank you to all of you for being with us this morning. We really anticipate having a really great conversation. We're gonna first have a couple of interviews with members of our professional advisory board. And up first, we're gonna have Dr. Patricia Pinovich. Dr. Pinovich is a member of our professional advisory board and spent 27 years at the Minnesota Epilepsy Group as a neurologist. Dr. Pinovich, good morning.
Good morning, Glenn, and good morning to everybody in your respective offices. Hope everybody is safe and well.
Great, and I hope the same as well. Thanks so much for being with us today, Dr. Pinovich. You know, we were able to talk ahead of time and gather a few questions, and so I want to tick through those questions and then hopefully take any questions from our community. Just a reminder to people, if you want to ask a question, you can do it through your pop-up window, submit the question for Dr. Pinovich, and if time permits, we will ask it. So with that being said, Dr. Pinovich, if people are unable to schedule an appointment with their doctor during this time, what options do they have?
I think one of the things we all have to be concerned about is our own worries about being isolated and not having contact with our medical providers in addition to our families. But I think you should rest assured that you do have access to the offices. The offices are open. The phones are being answered by front desk people, triage resources. And then they will take messages per usual and funnel them to doctor or nurse or as appropriate by triage. Also, most offices have electronic records with patient portals that they can access and send in questions as well. If a patient needs to be seen, there are resources in almost all offices at this time for telemedicine visits. Or if you're having trouble, like I would have trouble with technology, I could FaceTime as well with my office provider, which most of us have learned how to do in this time of social media. And also, I'm not sure how all offices work. I know that our office, if a patient really needs to be personally seen besides the telemedicine venue, there are some very limited appointments available with proper precautions being taken in the office as well. What we really would like to do is to have folks use some common sense about whether they actually really need to be seen. There are certain circumstances that would dictate to you that you should be seen, for sure, call. And then we could help you decide if you need to be seen. And then there are times that you may need to go to the emergency room, but that should be thought about very carefully. Certainly if you're injured, if you've had a very prolonged seizure, or you've had seizures that are just not stopping, those are emergency room visits, but we really want to husband those resources carefully. The other thing I think, I'm sorry, the other thing I think would be to just encourage everybody, again, my famous words to my children were, use your common sense. And in this time, that means really staying healthy and doing all you can to take care of yourself personally as well as your epilepsy. Continue with that social distancing and get out and get some exercise and walk.
You know, that's some really great advice, Dr. Panovich. One question that has come up is, if someone's seizure frequency increases during this time, what should they do?
So I think you're going to do some of the things that you would do normally in normal times as well, which is have an assessment about what is it that made things different for me right now. Obviously, all of us are having increased stress at this point in time. Stress sometimes causes changes in sleep patterns, and we may not be doing well with sleep, and we certainly know that that's a trigger for seizures. Evaluate what your own personal triggers were at the time and see if you can do anything to modify them at that time. Do you actually have your prescriptions? Are you actually taking your medicines at a regular time, not forgetting them? So if you can't figure it out, or if you just need some reassurance about that, that's certainly when you should pick up the phone and call the office. If things feel more emergent for you, hopefully many of you also have a seizure action plan. I'll say something more about that in a moment. But if you don't have a seizure action plan, for sure call the office. And again, if it's one of those emergency situations, you should go to the emergency room. I did want to say something about a seizure action plan. It's something that we're not perfect as providers, but we do try to provide to our patients, which is the what happens if scenario, so that you have something that you might actually take home with you that you could look at, or your caregiver could look at and sort of say, okay, under this circumstance, this is how I act. So it might be if you've missed your meds, how to do a makeup medicine, whether you change a dose in that scenario. If your seizures increase in a frequency mode, or if they're getting a little bit long, telling you how to act with either an extra dose of medicine or rescue medicine that might be prescribed as a use only as necessary medicine, or even when to call for EMS and go to the emergency room.
You know, those are some really important points as people think about their medication. It poses another question, which is, aside from continuing their medication schedule as prescribed, is there anything medication or prescription related people need to be aware of?
I think it's really important that you get a look at how much medicine you've got left and be forward looking about when you need to get that refill done. I would suggest that everybody act a little bit more proactively and try to have at least a week's worth of medicine that's still in your bottle. I would also really encourage people to use those pill boxes or a phone alarm system that reminds you to take medicines at time and on a regular basis, particularly when we're stressed and we're not in our usual routines. We think we've done something, but we haven't. We've forgotten it. We're off kilter, and that can certainly make things more difficult for controlling our seizures. There are, most of us worry about, I can't call for my refills yet because I still have a certain time limit before my next one's allowed to be distributed. Those rules and regs are considerably relaxed right now. So if you don't have a week's worth of medicine, please go ahead and act proactively and call your pharmacy. They'll call the doctor's office if they need some special directions.
Thank you for that, Dr. Panovich, particularly around making sure that people have the appropriate medication that potentially could be further out as we continue to follow the stay home orders. I have a couple questions coming in, and so I want to ask them as we have a few more minutes. Are people who have epilepsy considered people with underlying medical problems who should be more careful? Dr. Panovich, your thoughts on that?
I think it depends on what the cause of your epilepsy is. I mean, there are some, remember, epilepsy is a symptom for many different brain and systemic problems. So if you've had, your epilepsy comes from the fact that you've had a stroke because you have heart disease, then yet for sure you are. If you have your seizures and your epilepsy because you had a brain injury a long time ago with a brain lesion, then it doesn't put you in a particularly higher category. So you have to think about the whole picture. And certainly if you're one of the folks who have the devastating epilepsies of childhood, Dravet's or the Lennox-Gastaut folks, those folks are probably also a little bit more susceptible. And then the older population in general, those of us who may be older than 60, for sure.
Okay, okay. To that point, Dr. Pinovich, just an additional comment, and then I want to be mindful that we get to some of our other speakers. But there was a comment that was offered that just a reminder that people should have all of their adequate supplies they need as well to administer the meds. And I'm sure you'd advise people to seek the appropriate vendors because I know some people are running into challenges where some pieces are out of stock.
For sure. I mean, you have to assess what does it take to take your medicine. You have the tablet or the syrup or an injector or whatever, and you have to make sure you have all of those things available.
You know, to that point, Dr. Pinovich, I'm actually going to continue to ask a couple of the questions, and thanks to our community gathering, because the questions are flowing in, and thanks so much. One thing I'll say is that we won't be able to get to all of the questions, but we will get your question to Dr. Pinovich and follow up through email if we aren't able to get to it during our community gathering. But I want to take a couple more questions for you, Dr. Pinovich, if you're all right with that.
Sure.
Can you tell from the abnormality on your brain what it caused from by an MRI? Sorry, let me read that one more time. Can you tell from the abnormality on your brain what caused it from an MRI?
And the answer to this is sometimes yes and sometimes no. Sometimes there's very specific things, congenital malformations, things you've been born with where the brain hasn't developed normally that are very clearly demonstrated on the MRI. And sometimes you have an MRI where you can't really see anything and you can't say why the epilepsy has occurred.
Okay. Final question that I'll ask in this time with you, Dr. Pinovich, and thanks so much for being with us today. Ruth Schmitz asked, what about lab work that may need to be done during this time? What are your recommendations for someone where they may need to have lab work done?
I think because we are under these very funny circumstances that you might want to check in with your office about whether they actually feel it's necessary right now or if it could be put off for a later time.
Great, great. Well, Dr. Pinovich, thanks so much for being with us here this morning and answering not only some really important medical tips and advice for people, but taking some questions from our community, as I'm sure there's a heightened sense of concern to ensure that we are all safe. So really, we thank you for being with us here this morning. Any final thoughts?
Just once again, I hope everybody stays really safe, be healthy. Please remember my tips about social distancing and getting enough sleep and avoiding the triggers if you can to prevent your seizures from happening. Get out and exercise and stay safe and healthy. Take care, everybody.
Thank you, Dr. Pinovich. And thank you all for joining us with the EFMN community gathering. My name is Glenn Lloyd, and we were just on with Dr. Patricia Pinovich, who was offering some really important medical advice and tips. One note, as we have questions come in and we are unable to get to them during our community gathering, please know that we will submit your question to Dr. Penovich and ensure that her answer is sent back to you through your email. So once again, thank you all for joining us and really appreciate you being here with us. We're now going to welcome in Dr. Douglas Heck. Dr. Heck is also a member of our professional advisory board and is a clinical psychologist at the Duluth Psychological Clinic. Dr. Heck, good morning to you.
Good morning. Nice to be here with you and everyone else.
Great. Dr. Heck, I want to jump right in. Considering stress can lead to increased seizure frequency, what are some things people with epilepsy should be aware of when it comes to managing stress and their mental health in regards to COVID-19 and spending so much extra time indoors and at home?
Well, when I think of that, I think of some things that we have always promoted for people with epilepsy. And the biggest piece that we usually talk about is being an active manager of your epilepsy in the face of all of these different circumstances. So what that means is basically is that you who have epilepsy are becoming aware of and managing aspects of your epilepsy that can help it either stay relatively well controlled or be aware of things that might be causing you to have more frequent seizures. So the two most frequent and prominent risk factors for most people are either missing medication or being late with medication doses, but the other one is being sleep deprived. When we look at what's going on today, a lot of people's routines have been mixed up or are absent at this point. People are no longer maybe going to work or going to school or having their social activities going on. And so there's a lot of people who are not really having that structure during their day to try to help them manage their epilepsy. For example, people sometimes take their medicine before they go to work or they go to school, or they may take it before they go to bed at night. And sometimes those time frames are off at this point. So I'm encouraging people to try to find something else to anchor their time for their medicine to, something that's going on every day. Dr. Penovich mentioned using an alarm, and that's something that maybe more people could use at this point. Sleep is something that tends to be obviously important for all of us. And for people that are staying home, sometimes we find that people are sleeping more often, or maybe in some cases less often. And so being a manager of your epilepsy means taking a look at how often are you sleeping, when are you sleeping, and trying to keep it in that time frame at night so that your sleep is not working against you in terms of your seizure control. A third risk factor is obviously stress, and there's a lot of different kinds of stress going on right now for people. One of the things I encourage people to do is to be aware of how your stress shows up. And what that means is that for some people, when you're stressed, you become more irritable. For others, you tend to isolate and not connect with people as well. For others, they may eat more or eat less. And so I'm encouraging people to be aware during these times of how the stress is showing up in yourself, and again, actively managing that yourself so that you can take some action to try to help reduce the level of stress. One of the most important things for stress is to learn how to use the skills you have already in terms of breathing, relaxing, in some cases doing some meditation. For people that are familiar with phones, there's a number of apps that are available for people to use to help them breathe and to help relax. One in particular is called Calm. It's free, and it's a nice one to use. It's very relaxing for most people. A Smiling Mind is the name of another app that can be used. So those are all ones that I encourage people to use. And of course, you don't need an app to relax. So if you already have ways to relax, I'm encouraging people to build that into your day, perhaps more than you used to. Being aware of stress also is a matter of how your stress is impacting others. So if you are living with somebody and somebody else is showing some concern for you because you are disengaged, or maybe you've become more irritable or agitated, work together with that person and realize that everyone right now is under more duress, and it's a matter of staying connected and working well with those around you to try to manage the stress that's going on for you. And of course, unfortunately, some people resort to more drugs and alcohol during times of stress, and that's a big risk factor for more frequent seizures as well. So I'm encouraging people to certainly be careful and to moderate that if possible. Another factor in managing stress is being aware of resources, and I'm strongly encouraging people to connect with their local epilepsy representative or the EFMN office there in Minneapolis, St. Paul, in order to to become aware of the resources that are available. A number of different resources. People in the outer state area can do the same thing, and EFM can help them contact their local county offices, et cetera, to look into what resources are available for daycare, finances, delivery services, all sorts of things like that are good to know of, and they're out there, more so than we may think. And maybe the last couple things I would have to say about stress, Glenn, is that it's really, really important to stay connected. There are a few of us in the world that prefer to not connect, where we tend to be more introverts, and that's quite okay. But even for some introverts, it's important to be connected with people who are important in your life. And so this is a time to be using technology. A lot of times we try to encourage people not to use electronics too much, but nowadays I'm encouraging people to take advantage of it. And so FaceTime, Skype, all sorts of different Facebook ways of communicating, et cetera, are ways that I'm encouraging people to use. People are becoming very creative. They're calling somebody up on FaceTime and doing crossword puzzles together, or they're reading a chapter in a book together, or they may be cooking a meal and they're showing someone else on FaceTime what it is they're cooking and getting advice from mom or dad or somebody else about cooking. So there's ways of connecting maybe that we haven't done before. Setting up a lawn chair in your front yard and just sitting out there, even though you may not know anyone that's walking by. People I have found when I'm out walking around, people tend to be fairly friendly because we're not connecting as much as usual. So people are saying, hi, how are you doing, a lot more than perhaps usual. I'm also encouraging the musicians out there to really be active. The other day I was out and I saw somebody playing a guitar on his front porch. And for people walking by, it's a great opportunity just to sit and listen to some music for a while and calm themselves and realize that there's still some good things going on in this world, and there's a lot of people trying to make it through in good ways. You can't always get that if you're not getting out and seeing what's happening out there. And one other important thing from a psychological standpoint, Glenn, is that right now this particular circumstance has really introduced a lot of uncertainty into people's lives. And for many of us, when we have things going on in our lives that we're not sure about, it causes us anxiety. And that's not necessarily a bad thing, because then we start to plan ahead and figure out, what am I going to do if this happens or this happens? And that's a good thing. But if anxiety gets too high and starts to overwhelm us, then we start having panic, or we maybe don't sleep so well. And then we start having stress that is hurtful to us and not helpful to us. And so I'm encouraging people to learn how to tolerate uncertainty, because there's a lot of things that none of us can answer at this point. And it's important to understand that because we don't necessarily know what's going to be happening in a week or two, it doesn't necessarily mean that we're not going to be able to handle it. It just means that today we don't necessarily know the answer. But when things do happen in the future, we will be able to address those, and with help perhaps can get through some of those circumstances. So it's important for people to see that uncertainty doesn't necessarily mean that we're in trouble. Uncertainty just means that today, in this moment, I'm not really sure what's going to be going on next Wednesday, for example. And to become more familiar with uncertainty and less frightened by it. So those are a few things that I would have to say.
Well, Dr. Heck, I'm just going to say that from my own anecdotal experiences, I can affirm the sitting outside and speaking to people. It takes me back to my childhood of growing up in the South, that speaking to people as they walk by was standard, and there seems to be a re-engagement of
Exactly.
speaking to one another because we aren't able to put that into our own lives.
It's nice to see.
Yeah. To that point, I want to shift gears a little bit and ask about parents who have a child with epilepsy. Their kid is maybe having to manage an online learning system and isn't able to see their friends as much. What can parents do to keep an eye on the mental well-being of their kids at this time?
Yeah, I think that the signals most parents are pretty aware of when their child is stressed, and every child is different. Some children, become more agitated and run around a lot more, especially depending on how old they are. Some children disengage. It's the same as adults. Children have their own patterns of stress, and parents sometimes are aware of that. I rely a lot on parental judgment as to how much to talk with kids about what's going on. The older children do often do well with understanding exactly what's going on, and younger children maybe don't need to know so much. But for younger children in particular, it's about feeling safe. It's about knowing that even though my world right now and our world is really different, and mom and dad are home a lot more, it doesn't mean that I'm in trouble, or it doesn't mean that things are bad. And so it's for younger children, it's about reframing the situation into something that helps them feel safe and secure. For older children and teenagers, especially as children get older, it's much more about helping those kids stay connected with their friends. Maybe parents become less of a influence at that point, and their friends are much more important. And so assisting these older children to stay connected in safe ways can be a very important way. I recently found that for parents and families that have access to the internet, there's a tremendous amount of things that are available now that haven't been available. For example, the Smithsonian Museum, the Natural History Museum, is now completely online. And so for children who like dinosaurs, for example, it's a great time to sit in front of your computer and take them through and have them look and see what a Tyrannosaurus Rex looks like and talk about that. Or pick a dinosaur to talk about for one day and a different dinosaur the next day. The castles of Europe are now online, so you can take virtual tours of that. And for people that really want a lot of excitement, there's even virtual tour of Duluth right now, so online, so people can come visit Duluth even though you can't come up here in person.
Yeah.
So I encourage for families to take advantage of the internet when possible. For families that don't have access to the internet, it's really about, especially for younger children, helping them feel that in spite of the different circumstances, they're going to be okay and that they are safe and secure, and try to provide that structure and routine for children as much as possible in the home.
Yeah, Dr. Heck, just some great recommendations, and thank you once again to everyone for joining us at the EFMN community gathering this morning. We are just so appreciative for Dr. Pinovich being with us and providing medical advice and tips, and now with Dr. Douglas Heck out of Duluth, giving us some important tips and thoughts around how to maintain and achieve mental well-being and a certain sense of wellness during these difficult times of COVID-19. Dr. Heck, I got a question that her son drinks on the average of at least 4 cups of coffee in the morning. He noticed that he is jittery. He likes the energy because it gives him energy from the lack of sleep the night before. Is caffeine okay? And just a little bit of background about her son. He's 24 years old and has epilepsy from brain surgery to remove a choleid cyst. So the question I think is caffeine okay in the course of people finding a routine and trying to boost their energy?
Well, it's a very individualized question. Depending on, some people can tolerate caffeine and others can't. Others do quite fine with very moderate doses of caffeine. Others don't do well when it gets above a couple cups of coffee or so per day. It really is individualized, and I would look to see what effects the caffeine is having on this particular young man. Is he sleeping well? Is he having a lot of anxiety? Is he irritable? Those kind of things sometimes can come about from too much caffeine. If one is not sleeping well and then trying to compensate by jazzing yourself up with a lot of caffeine the next morning, and then the next night maybe not sleeping so well because your body's been full of caffeine, then you're just getting into a really destructive cycle. And so I'm really encouraging a very limited use of caffeine for most people. Back in the day, we looked at caffeine and how long it stays in the system, and it typically stays in the system way longer than we think. So I'm typically encouraging people to get off of caffeine by early afternoon, 1 o'clock or so, so that they can be adequately sleeping at night. That's kind of my response. It kind of depends on the effects on that particular person.
Yeah. Well, thanks to that point. And finally, I wanted to add, Dr. Pinovich shot me a quick note, and just wanted to add another reminder, and I'll leave you with the final word around Dr. Pinovich's thought, which is to encourage people to limit their consumption of the news right now in an effort to manage stress and the uncertainty. So final thoughts around that point, and anything else as you leave us as a final thought.
Very good point, Dr. Pinovich, and it's good for all of us to be limiting. That's part of tolerating, I think, to some extent, managing our stress and tolerating uncertainty. Sometimes when we're uncertain about what happened today, what's going wrong today, or who's getting into trouble today, a lot of times it gets seductive, and we kind of want to start looking at it more and more and more. And so for most of my clients, I'm really advocating very limited use of not only the news, but also social media. Social media sometimes is helpful, but sometimes there's a lot of negative people on there. And it's good to not necessarily be running through that all day, every day. So I think it's a great point by Dr. Pinovich. Completely agree.
Well, thanks so much for being with us this morning, Dr. Heck, and we really appreciate all you're doing for the epilepsy community. We hope you continue to stay safe and stay positive, and we will talk to you at a later date.
Thank you. Thank you for this opportunity.
Great. Well, with that, just a flurry of great advice that came from Dr. Heck, and we want to thank you for joining us at the EFMN community gathering. We will ask a few more poll questions, but to outline where we have a few more minutes in this webinar and community gathering, we will hear from our EFMN staff, two of our key EFMN staff who provide information service as well as updates around our programs and events. So you'll want to stick around for that. We want to thank Dr. Pinovich and Dr. Heck from our professional advisory board who joined us to provide medical advice and tips, as well as mental well-being and mental wellness tips. This community gathering is also being recorded and will be emailed back out to our community. So if you missed their interviews, please know that this community gathering is being recorded and is available for your viewing. Finally, a quick note on the questions that are coming in. Thanks so much for your engagement. As you have a question for our specific speaker and we are unable to get to it, we will have our speakers address your questions in writing, and then we will submit those answers back to you. So thanks so much for being here with us. Mindful that over the next few minutes, we want to bring on a few of our EFMN staff and talk about the resources that we offer. I want to welcome Debbie Leone to our conversation. Debbie is our Senior Coordinator of Information Services and has been with EFMN for 3 years. Debbie is joining us from St. Louis Park this morning. Good morning, Debbie.
Good morning, Glenn.
Good morning. Debbie, real quick, how is Information Services able to assist people during this time?
Well, I just want to reassure people, excuse me, I'll do the proper kind of coughing there. I want to reassure people that we are still here. We are continuing to provide that one-on-one support for individuals who are affected by epilepsy in any way. So we can, if you call us or email us, we can answer your questions on a wide variety of topics, everything from general epilepsy information to questions about driving or employment or Social Security, disability, If you aren't sure whether it's a question we can answer, I encourage you to ask. And if I can't find the answer, if I don't know the answer, I will do my best to find it or to refer you to someone, other individual or organization who can answer your question. We're also continuing to do referrals. So if you're looking for a healthcare provider or a social service agency, or you need some assistance with paying for prescriptions or food, or you have housing questions, we're making referrals to those organizations who can help you when we can't help you directly. So we can be reached, and I say we, I mean me, because I'm typically the one who answers the phone when you call Information Services. I can be reached at 651-287-2303. If you prefer not to talk on the phone, I know a lot of people don't like the phone, they prefer electronic communication. You can email me at dleone@efmn.org, and that's DLEONE@efmn.org. We also have multiple points of access on our website. So you can go to efmn.org and you can go to the information services page, or if it's an employment question, you can go to the employment page, and there are forms on there where you can submit your question, and those will come directly to me. You know, we know that epilepsy can be an isolating condition even in the best of circumstances. And so right now, when it seems like everything around us is shutting down, and yes, our doors are shut at our St. Paul office, but we are still here to serve you. So please don't hesitate to reach out.
You know, Debbie, that's really encouraging and reaffirming the continued commitment that we have come to appreciate from you being the other end of the phone. I want to ask you one more question, which is, Debbie, what types of social services are available to people who may be struggling right now?
We know that there are extra challenges people are facing right now, and it can be scary. And I believe it was Dr. Penovich who maybe it was Dr. Peck, one of them said, you know, that there are still resources out there, and I want people to know that that's true. And those can vary depending on where you live. As Dr. Heck said, we serve the entire state of Minnesota and the eastern part of North Dakota. So different services will be available, possibly depending on where you live. But we know that there are many governments, agencies, many organizations who have instituted policies or have adapted their activities or their operations so that they can meet people's needs during this crisis. So, I mean, things like if you've lost your income, certainly by now most people know that there are expanded unemployment benefits. Hopefully many of us will be receiving those federal stimulus checks to assist with that loss of income. If you're concerned about health insurance, there's a special enrollment period now for MinSure for those who may have lost their health insurance and need to pick up new insurance. It seems strange right now when many have lost their jobs, or many others are working from home, to be thinking about employment, but the career force counselors are still out there working. They're doing it remotely. They're doing phone appointments, so those are available. We have online job boards that we can let you know about. If you're having issues with accessing medication or healthcare, as Dr. Penovich mentioned, there have been some relaxation of some of the rules, especially for those on Medicare and those on MA, Medicaid, as far as being able to fill a 90-day prescription instead of a 30-day prescription. The availability of telemedicine. Many pharmacies now are providing free delivery so that you don't have to go outside. You know, again, there's just so many. I could probably spend, 20 minutes here talking about the different areas where people may be having challenges with getting food, housing issues, internet access. There are many cities and organizations that are stepping up, and they're providing either free or reduced cost internet, which is really important right now with so many kids learning from home. So I just encourage you, again, as I said, if you're not sure if we can help, give me a call. I will do my best to identify what resources are available in your area. And we do try to tailor our responses to you rather than just give a general, oh, we'll try calling, this. We'll try to find what the organization is in your area that might be able to help you.
Debbie, just you being able to list off the many different resources that are being offered right now, I'm sure that it feels like there's an endless list of resources, but it is so important that people know that they can reach out to us to get an individualized conversation about their needs. And so thank you, Debbie, for what you're doing on behalf of people living with epilepsy as they seek answers during this uncertain time. Any final thoughts that you have for us, Debbie?
I'd just like to echo something that Dr. Penovich said when she was talking about medication and not waiting until the last minute on things. If you're facing a possible problem with something, whether that's food or employment or whatever it is that you're concerned about, don't wait until it becomes a crisis to call us. We want to help, and often the earlier you call, the more options there might be for you. So, again, we can't, unfortunately, we can't fix every problem, but we sure do our best to give you the resources and point you in the direction of where you can get help. So please take advantage of that and reach out to us. And stay safe.
Great. Well, thank you, Debbie, and you stay safe as well. I'm mindful that we are getting so much good advice that I want to keep our conversation moving and want to bring on Kevin Gahagan because I think it's important that we talk about our programs and events at EFMN. I know many of you have come to rely on EFMN as a point of connection with those who are also living with epilepsy and supporting loved ones with epilepsy. Kevin is our senior program manager, a role he's been in for just over a year, and joining us from Minneapolis this morning. Kevin, good morning.
Good morning, Glenn. Thanks so much for having me.
Yeah, glad to have you. Kevin, as you work with the program team and are trying to meet the challenges that have sprouted up during COVID-19, what has your team done to adapt to the new challenges of supporting everyone with epilepsy on a virtual platform?
Yeah, we talk a lot about community and the epilepsy community and how we support our communities. And obviously, it's been a challenge with not being able to have those in-person events right now or our training. So we've done a lot of work to try to adapt our services, make sure that we're still offering all the same support that we were before the COVID-19 crisis. So a couple of things that we have coming up or always offer. So we have virtual trainings for anybody. These are seizure recognition response trainings. Our trainings have always been a thing, and we've always been able to do them virtually, but we're building them out now with COVID-19. And those trainings are available for whatever audience that you're part of. So if you're a teacher and you have a virtual classroom and you're looking for a training with your students, or school staff would like to get a little bit more familiar with seizure recognition response. Right now during staff development, we work with daycares, employers, caregivers, so anybody, we can tailor a custom training for them. Another thing that we have available right now are webinars. We have about 5 webinars coming up over the next couple of months. And these are open to a broader community. Usually they're education-focused topics. So we're gonna have a couple of webinars coming up about ADA accommodation, disclosure. We've had webinars in the past about newly diagnosed people and resources that are available for them, seizure alert devices. And we've also had those those Seizure Smart trainings available in webinar format. We have a couple coming up over the next couple of months. And those are really to train and educate people about epilepsy and what to do in the event of a seizure. And if everybody looks at the dashboard, at their kind of whatever it's called, their toolbar over there, there's a little section called handouts. And if you click on that, we have a resource handout that you can just click on and download to your web browser that has general resources, links to our upcoming webinars, and a lot more. So make sure that you download it, please.
That's great, Kevin. And I'm sure that handout will also be available that we'll send out through a follow-up email.
Yes, absolutely.
Great. You know, one program that EFMN has offered across the entire service area is our Connect groups. Can you tell us a bit about the function of these groups and how EFMN is responding to the need for Connect groups?
Yeah, I mean, we've again talked a lot about community and trying to maintain connections with people during this period of isolation, right? And Connect groups, it's a really a vital opportunity for anyone that's on their epilepsy journey to come together, share common experiences, decrease that sense of isolation and stigmatization that they might feel, and really create their own support network. So the step of finding a healthy and healing support group is extremely helpful and often essential for those diagnosed with epilepsy or affected by epilepsy. So we're really excited to announce that we're rolling out virtual Connect groups. This week we'll have our first one with the Teen Connect group, and they're really in response to the stay-at-home orders, the social distancing recommendations, and to still be able to give those opportunities to connect with others affected by epilepsy. So like I said, this Thursday we have our first one with the Teen Connect group. That's April 9th from 4 to 5 p.m. And then next week we'll have a parent and caregiver Connect group next Tuesday, April 14th from 6:30 to 7:30. And then next Thursday we'll have an adult Connect group from 6:30 to 7:30. And you can find out all the information about how these Connect groups will work virtually and registration either on the handout sheet that I just mentioned or by going to our website, efmn.org, and clicking on the calendar tab.
You know, real quick to that point, Kevin, and all of the ways that people are connecting, do you have any updates about our annual overnight summer camp program for kids with epilepsy, Camp Oz?
Yeah, absolutely. So if you're not familiar, Camp Oz is our week-long overnight camp for kids with epilepsy. This year it's going to be June 14th through 19th, and it's located at YMCA Camp St. Croix in Hudson, Wisconsin. So far registration's been great, but obviously we've talked a lot about uncertainty today and things changing very quickly. So I want to give an update and just say, you know, as of today, we're still planning on having Camp Oz as normal. And of course, things can and have changed quickly, especially with summer programming. You know, I'm sure people have seen that Minneapolis Parks and Rec has canceled all their summer programming, so things are changing at a pretty quick pace. But we're closely monitoring the situation in Wisconsin, since our camp is in Hudson, Wisconsin, and seeing what they're doing with their stay-at-home or social distancing orders. We're also in constant contact with the YMCA there too, so really making sure that we know what they're thinking, what we're thinking, and of course we'll notify families of any changes as soon as we hear of any. So we also have a financial aid policy where we don't want costs to be a barrier for anyone to attend. So we recommend that people register if they're concerned about cost, or also of cancellation with cost too. We have a 100% reimbursement policy in the event of cancellation. So of course we would refund that money if you have registered, if we did cancel, or if you'd like to donate your registration to EFMN, you can also do that. But we'll make sure to update people as soon as anything's changed with Camp Oz.
You know, that's really good to hear about Camp Oz and your preparations, both for moving ahead and in the potential for a contingency plan. That brings up a thought around one more event, and I know we're gone over time, but we'd really appreciate this update as we start to look outside and temperatures start to warm, and we look towards the potential that it's safe for us to gather. Do you have an update of what we're thinking with the walks? The regional walks that are happening in Fargo and Duluth and St. Cloud and Rochester. Do you have any updates there?
Sure, yeah. You know, a big update that I'm excited to share is that we're joining the Epilepsy Foundation National Program of Walk to End Epilepsy and End the Stigma this year. So this goes beyond working to find a cure. It's about how each of one of us is able to make an impact today by showing the strength of our community and standing by those that we love and care about. So it's really about raising awareness, being open about epilepsy, and that's how we fight to end that stigma. It's really about creating understanding. So like you mentioned, we'll be excited to bring people together for a celebration when it's safe to do so. The walk's always been a great community event, but of course now more than ever, we're excited to see those friendly faces that come out. So our dates for the walks as planned right now, August 6th will be our regional walks. So that'll be in Duluth, Fargo, Rochester, and St. Cloud, where we'll be having those walks. That's August 6th is when we're planning. And then for the Twin Cities metro area, it'll be October 3rd. So registration is currently open right now, so please visit our Facebook page, or you can also go to efmn.org/walk to create your own walk team, and you can start inviting your friends to join. So we're really looking forward to those, and we hope that those walk events will kind of help with the normality as we kind of get back to our regular life.
Yeah, well, I'm really looking forward to the walks this year. And Kevin, really appreciate you and our program staff, whether it's Lisa Peterson in Duluth and Amy Haugen in St. Cloud, and the team that's based out of the Twin Cities. From all of us, we want to say thank you for all you're doing, and any final thoughts you have for us.
No, just remember that we're still here. We're offering all the same services and support too. So please let us know how we can help you in this situation.
Great, great. Well, thank you, Kevin, and thank you to all of you that as you've joined us for our EFMN community gathering. Before you go, we wanted to take a moment to look ahead. You know, you're going to go out and go forward with your day today and into the coming weeks. And I want to encourage you to keep in mind this next video. Our hope is to continue to be your support and inspiration, where you look at each other's lives and find glimmers of hope to continue to wake up each day and continue your journey. Well, one of our families has been living with epilepsy for 5 years and having their own kind of beautiful experience. So with that in mind, we want to share with you a video. Thank you to everyone who sent in selfies in this past week to help make this video possible. And thanks to the Buck Simrow family for their resilience and passion. We want to share this video with you, and we hope that this can brighten your day. So please enjoy, and then we'll come back for some final thoughts from me.
This is our son, Cody. He was diagnosed with epilepsy when he was 4 years old. Since then, we've gone through misread MRIs, multiple medication changes, and unpredictable medication side effects. Cody is now 9 years old, and we've come to accept he'll likely never have full seizure control. Our family tries to celebrate life in the time between his seizures. Yet we can so easily get bogged down in battling epilepsy that we forget to enjoy our lives. We get so wrapped up in the grief, the daily worry, and the what ifs that we forget to take a break and focus on the things that bring us joy. Over the last year, we've had the pleasure of getting to know Cody's favorite musician, Jason Gray. This song by Jason brings our family joy. It brings Cody joy, and I hope it does the same for you today.
If you got a beat that's a bit unique, keep dancing to the rhythm. If you get your own thing, don't be afraid of what everybody's thinking. People will say what they want to, but pay them no mind. Darling, you're different, but who says that's something to hide? Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you who can do it like you do. Be your own kind of beautiful. Take it from me, you don't wanna be stuck playing someone that you're not. And if you swipe left on yourself too many times, you lose the only you got. You know that people will say anything to make you fall in line. But kid, you got courage to step out and let yourself shine. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you who can do it like you do. Be your own kind of beautiful. change the whole world just by being who you are. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you who can do it like you do. Be your own kind of beautiful. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you who can do it like you do. Be your own kind of beautiful. Be your own kind of beautiful.
Wow. If you're like me, it's so heartwarming to see so many of you that are showing your own type of beautiful out there in these really difficult and challenging times. Um, I just want to say a deep appreciation to all of you that joined us today and to our staff at the Epilepsy Foundation of Minnesota for your continued support. As so many of you have looked uncertain times in the eye and you fought to make a way for all of the love that you feel in your heart to make sure that others know that it'll be all right. I want to send you off today saying you are the beacon of hope that so many people need in the world today. You know, for many of us, we've never experienced a world of uncertainty that we couldn't snap ourselves back into reality. But you, our epilepsy community, have shown many others what it's like to look tough times and square it down and say, no, I fight to have the normalcy and the freedom that I know matters. And so thank you to your own journey. Thank you for the love you continue to show by gathering. Thank you for continuing to wrap your arms around one another and encourage one another. Through this difficult COVID-19 time, I deeply believe that it is people like you, people living with epilepsy, people living with complex medical diagnoses that we can all continue to learn from. And so as you go forward today, know that your journey that has undoubtedly been marked by uncertainty, that your passion for life can be the very message that someone else needs as they confront their own time of uncertainty. And together we can come out of this with the spirit of connection and solidarity, that through it all, we did it together. We leave you with the hopes that you will be safe, be healthy, and above all, stay positive. Thanks for joining us, everyone.